Pharmacy Services Boot Camp at the PSW meeting back in the late summer. At that particular meeting, I had a couple of pharmacy students, and actually Carrie Trapskin provided content for that meeting. So please note those individuals' names on the bottom of this slide, because without their work, this wouldn't be available to you. But at this time, I'm going to have Olivia Thomas, my pharmacy certified pharmacy technician at Boscobel Pharmacy. We're going to offer a review of how we perform the Wisconsin Medicaid billings at Boscobel Pharmacy. So the objectives for our portion of this webinar this morning are to discuss Wisconsin-specific payment opportunities and the resources available for those, and then outline a plan for incorporating this new opportunity into the community pharmacy setting. So just a reminder, current opportunities in Wisconsin, as Jake had suggested, the Wisconsin Pharmacy Quality Collaborative is an active network of Wisconsin community pharmacies providing care to patients. This year marks our 10-year anniversary. I have no idea where that time went. And we're shooting for a goal of 10,000 CMRs by the end of March 2019. So with that, I hope that this webinar really empowers you to feel like that's something you can accomplish. Other current opportunities in Wisconsin, there's a variety of pilots. There's some managed care contracts with individual pharmacies. And of course, we've got the Medicare Part D opportunities that are being pushed to us by Marixa and Outcomes. So resources available from the WPQC Pharmacy Society of Wisconsin side of things. There are coaching work groups. I believe my resident is currently involved in one that is either ongoing or just wrapping up. The WPQC website is a plethora of resources. Of course, we've got the clinical toolkits that my students really enjoy utilizing as they're meeting with patients with various chronic diseases. There's free webinars on the PSW website, and you can certainly reach out to Carrie Trapskin with any questions related to resources or any gaps you see in the materials provided. But PSW provides us that connection with state agencies and partners, and has that 10-year relationship with those partners that I think is really synergistic, and we're going to be able to work off of moving forward. So within your own pharmacy, in the walls of your pharmacy, thinking a little bit about how you provide care and what you're doing with your time. I've been really working hard, moving into 2019 to impress upon my staff that time is gold, and it is so important that every individual in the pharmacy is operating at the top of their license, and then remembering that success is a team sport, and it takes every person, every level, from pharmacy assistants and clerks to the technicians, to the high school students making the place look clean, to the pharmacists being excited about providing these services. It takes every member of the team to really get successful and efficient at these activities. And I've really asked my staff to think a little bit about what happens when they go to a medical doctor appointment. Does the medical doctor do every step along the way? Because when I first started doing these services, yes, I did every step along the way. I made my appointments, I gathered my information, I met with the patient from start to finish, and I did the billing. Oftentimes at the end of the day, maybe while watching a Packer game or a Badger game, I was trying to do my billing just to make sure I could staff the pharmacy the next day. But my life has gotten so much better, and I think my pharmacy's ability to offer these services effectively has grown tremendously by integrating technicians and other staff into the process. We totally utilize our students as well, and I have a resident this year, but we really are working hard at identifying extenders for ourselves. And with that, I think we've become tremendously successful at offering the service within the pharmacy. So you might ask, what can technicians do to elevate an MTM practice? They can be trained to identify gaps in care, identify non-adherence. They can then bring these identified patients to the attention to the pharmacist to be further evaluated. Technicians can also be performed to offer or to provide the actual intake portion of a comprehensive medication review. That piece, the taking a blood pressure, the taking a weight, the testing of blood sugar, can take 15, 20 minutes. So that's really valuable time that a technician is completely capable of doing, kind of like a medical assistant, in evaluating the patient's profile and making sure they're taking what your pharmacy says they're taking. And then they can start the prior authorization process. They can bill for the service after completion. So just an example workflow in our pharmacy and basketball pharmacy is that we identify billable patients. All staff perform that. Starting the process, which is gathering paperwork largely and getting a prior authorization, is completed by the technician and the bookkeeper. Calling and scheduling appointments can be performed by technicians, but there are times when the pharmacists provide that as well. And then completing the appointment can be completed by technicians, pharmacists, or students. At Basketball Pharmacy, we try to have a primary pharmacist driver for the appointment if we are incorporating the student into the mix, and make sure that the students have an opportunity to watch us do one of these before we actually put them in charge of completing the CMR. And then the billing portion is completely handled by my technician staff at this point. So some of the things I'd like you to think about as well, just contributing factors to success, recognizing the importance of electronic health record access. We are fortunate to have access to Gunderson EHR. We also are very fortunate that we have local providers that are aware of the services we're offering and able to co-market those services. We utilize our technicians and students, and then we've made sure that through pharmacy staff meetings and daily huddles that there's good communication across the pharmacy team as to what is happening within these services and within providing a comprehensive medication review. So with that, I'm going to turn the reins over to Olivia Thomas, our pharmacy technician, and she's going to go through the handling of the prior authorization process and other key pieces of billing. So with that, I'm going to hand the telephone over to Olivia. So this is just going to take a minute for the transition. Thanks for your time.
Good morning, everybody. This is Olivia. So I'm going to go over a few steps, and I have some print screens as well as we go, so feel free to interrupt me, stop me if you have any questions. I will have a couple points that I will stop and see if you guys need to ask anything as we go. So the determining eligibility and obtaining a prior authorization. So once a patient is flagged as a potential CMR patient, we need to determine if the patient is eligible for Wisconsin Medicaid or senior care. If they meet one of the eligibility criteria, they cannot reside in a skilled nursing home or nursing facility. And then the patient or a caregiver is able and willing to come in for a face-to-face meeting. We were able to find an excerpt from Wisconsin Medicaid that it can be a caregiver on the member's behalf if need be, and I did put that in there. So once all of those are met, we can call the DAPO Center for a prior authorization. One thing, if the patient is senior care, we have found it is easier to check their spend down status at the beginning and not after you build a claim and realize you weren't going to get paid for it. So if anybody doesn't know how to do that, let me know, but it is in the eligibility tab on the Wisconsin portal. And it's just a little bit down. You can see spend down, and it shows how much left of their spend down they have. So if they have a spend down left, then the entire portion of the claim will go towards their spend down. Therefore, they would be responsible for that balance of your CMR. So to obtain a prior authorization from the DAPO Center, you can go out to the PSW website and download their form. That's the one we use, and that's how to get there. So once you get to the website, you go to the WPQC tab and follow those those links there. And there's several options for the back page of that form. There's a diabetic focused review, asthma, heart failure, geriatric syndrome. So we use the consult or the generic one ourselves, but you can definitely print off any of the above and use them based on the type of visit that you are seeing the patient for as well. So this is the top portion of the front page, and I have highlighted the main areas that you're going to need for getting the prior authorization. So the name, date of birth, member ID number for their Medicaid or senior care. You'll need the pharmacy NPI as well as the pharmacist that's performing the CMR. The eligibility criteria, so how they are eligible for that visit. And then over on the right-hand side, the CPT code, new versus existing, they will say new or established sometimes when you call. That's if the patient has received an MTM in the past or not. That's just how they are going to code the prior authorization. If the eligibility criteria is 2 or more conditions with the 4 or more meds, you will need to tell them what the conditions are. So I circled that on the bottom left there. And then you'll need to tell them what the at least 4 medications are, as well as if they are diabetic, you'll need to tell them what diabetic medications they take. So I have all of that filled out before I call the DAPO Center so that I'm ready to go once I get them on the phone. And it's a pretty easy phone call then once you get them to answer. Any questions on eligibility or calling to get the prior authorization at this point? All right, so we'll move on to billing then. So to bill, we're going to go to the Forward Health portal. Once you sign in, we're going to go to the Claims tab and then submit a professional claim. And we're going to enter the member ID number in that box and hit tab. Once you hit tab, the last name, first name, and date of birth will populate in those fields. And of course, you'll want to make sure you have the right patient information then. Your total charge is going to be your usual and customary for your visit. And that's your procedure codes added together. Then you'll need to click on the diagnosis link there and add in diagnosis box number 1 the main diagnosis of the visit. So if the patient is diabetic and that's how you qualified them, you will use the diagnosis code of the diabetes. If you saw them for heart failure, that's the code that you'll use. If it was the 2 or more conditions, I would use the code that you most talked about or that you used as far as their med review. Down towards the bottom or the middle section of the screen, your dates of service, of course, are the date that you saw the patient. The procedure code is based on your answer to the new or established that you told the DAPO Center when you got the prior authorization. So over on the right-hand side, the big red box, the 99605 is a new patient who has never had an MTM billing before. And then the 99606 is an established patient. Every patient will only ever have a 99605 once. every meeting after that will always be a 99606. So if they've ever had a MTM billing, they're going to be a 606. So that includes any level 1s when they used to pay for level 1s or any level 2s. So you can search that by looking at previous claims. Under the claims tab, you can do a claim search for that patient and see if they've ever had any before when you call the DAPO center. So whatever you tell them when you get the prior authorization, you'll need to mark that on your sheet so that when the person that's doing the billing knows which code to enter here when they do the billing after the visit has happened. The modifier is going to be a UA for the initial visit and then a UB for the 3 follow-up visits. So depending on which visit, of course, you're billing for, you're going to put in the correct modifier. The diagnosis code pointer, that is going to point to the box that you put the diagnosis code in. So we put the code in diagnosis box 1 up here, a little higher on the screen. So therefore, we're going to put the pointer in number 1 there. 1 unit of $125. Again, that is going to be the same dollar amount that you put up here in the total charge up towards the top of the page. Those numbers do have 01, which is pharmacy. So once all of those boxes are filled in, you will scroll down to the bottom and hit submit. And once the page refreshes, I would scroll all the way down to the bottom of the page to see your pay status. If it's at a paid claim, make sure your paid amount is a dollar amount. So initial visit is going to be $85 and a follow-up visit will be $40. If you get a paid claim, well, I guess we'll get to that. Rejected claims or paid with $0 amount. So a rejected claim will most likely go into a suspend status. Most suspended claims are because your claim does not match the prior authorization. And those are the things that we talked about. Your procedure code doesn't match what the DAPO center entered in. So if they asked you if the patient was new or established and you said new, but then you billed it as established, or vice versa, you said new, but the DAPO center inadvertently put in established. So a couple of things, you can look up the prior authorization in the portal by going to the prior authorization tab and then looking up the patient's ID number. It's under a physician prior authorization. You just have to click on them. You'll know by the date of the prior authorization, the date that you called. Just click on it and then you'll be able to see it's a 4-line prior authorization and you'll see the code on there, whether it's a 99605 or a 99606. So that would be the first thing I would check. That's always, I would say that's 8 out of 10 times that I get a suspended status on a claim is because I have the wrong procedure code. And so that's the first place I look. The second place is the date. So sometimes the patient might sign that they're, yes, I will be seen, but I don't have time today. I'm going to come back tomorrow. So they signed with today's dates, but the appointment was really tomorrow and I missed that. Or you need to check the date of the prior authorization and the code of the prior authorization. Those are the biggest things that can happen when you get a suspended status. The other one that I get once in a while is that the patient was eligible when the PA was obtained, but is not eligible once the visit was done. So that is going to happen when the PA was obtained at the end of the month and the visit was after the first of the month and their eligibility fell off. Most generally, when you call the DAPO center, they will tell you, hey, the patient's eligibility ends at the end of the month. But there have been a few times that they didn't tell me that or they didn't know that to tell me that. And so then by the time we billed it after the first of the month, the patient was ineligible. And then the last thing is a paid claim, but with a 0 paid amount. And that is a senior care patient, usually with a deductible or a spend down. And that is why we now check that spend down status or deductible status before we get the prior authorization, because the DAPO will not tell you that, unfortunately. Any questions on billing the claim? right. Reconciliation of the claims. This is with the ICN number over on the left-hand side underlined in red. They look a little different if you were to look at your whole EOB and look at your like online adjudicated claims through your software system. Their ICNs are going to be one set of numbers. Anything billed on the portal is going to, the set of numbers is going to be a little different. And it's been a while since I've had to look. I believe that the online, I think, are 2.2, where the ones that you adjudicate through your software are like a 2.0, I think. Don't quote me on that, but once you look through them, you'll see a difference, and so they're easy to pick out. Now, when we bill on the portal, you have immediate gratification on your claims, so you can see right now if you have a paid claim. And so as far as reconciling, it's easy because you know that you got paid and you don't need to worry about the EOB as much. At least I don't. So if you have a rejection, you can fix your rejection right there on the portal and go forward. And so when the EOB comes, you'll see the rejection, but you'll also see a line that you fixed it. Oh, and I forgot to mention here, you cannot fix a suspended claim on the portal. You do have to re-enter the whole claim and hit resubmit. After you submit the claim on the portal, you do need to the claim. So for that one, you go to the Providers tab. And then over on the right-hand side, it is under Medication Therapy Management Documentation Storage. You are going to create a new medication therapy management record. Here you're going to enter the member ID, and you need to click Search on this page, and your patient information will come up. Of course, you need to make sure that that is the correct patient. On this screen, you need to answer if the patient is currently residing in a nursing home, yes or no. If you answer yes, you shouldn't have billed the claim, so your answer should always be no here. The pharmacy NPI and pharmacy name should automatically populate. The prescriber information is not required in this area. So if it's not a prescriber referred MTM, excuse me, I usually don't put that. If it's a prescriber referred CMR, then obviously I would enter that here. And then the date of the MTM goes at the bottom. And did the member consent to the MTM service? Of course, your answer needs to be yes there. And then next. Here you can select any and all of the MTM services that the member received. So the very bottom one is your level 2 CMR. This top portion is why the patient was seen. So if this was a follow-up or a second appointment, your answer needs to be the fourth option down, which is follow-up to an initial CMR. And then you have the question, does a member have other insurance? Yes or no? And if yes, does the insurance cover this MTM? So you need to answer that question. And then further down the screen this is how the patient qualified. So if this was a first visit, then this top portion and the bottom portion actually are identical questions. But if it's a second visit, then the top portion is just the follow-up and the bottom portion is the criteria. So the patient is diabetic or was discharged from a hospital, so on and so forth. Then the very bottom set of questions is, was the prior authorization obtained, yes or no? And then the date of the visit, and then was the member's signature obtained, yes or no? And then the date of the signature. Next, here you can answer if there were any level 1s identified during the CMR. And on the WPQC forms, if you downloaded those and are using those, there is a spot that asks if any of these, how many times the patient has visited the emergency department, hospitalized, or seen their PCP in the last 12 months, or since their last CMR if it's a follow-up. Answer those questions. Now, these questions are based on your criteria that you have chosen that the patient has met for the CMR. So back a few pages ago, I chose diabetic. So it's going to ask the A1C and the LDL. So this is where having access to the patient's EHR is very nice. So a lot of times we will have the patient's labs pulled before the patient's ever here, and then we can kind of talk to the patient about those. And so we have those and not going by what the patient remembers them being, or we can actually have access to that. And then I put a slide in here quick so that you know what this slide is going to look like based on your answer to why the patient qualified for the CMR. So if you chose diabetic, those are the questions that are going to be asked, hypertension, asthma, so on and so forth. So you know going into it what you're going to need to gather or ask the patient when they get there. And then here, any additional information, I usually keep this short and sweet because we have digital files for all of our CMR patients. And so we scan all of our documentation and paperwork, lab works that we've printed out of their EHR. We scan them into their digital file. And so I kind of just put a note in here, see all their scans, see their lab work. But you can definitely add any notes that you want to add there. I just kind of point to the direction of their file there. And then this would be the pharmacist that provided the service and the date that this was documented or billed. They do need to enter their MPI and type their name. So if the technician or bookkeeper is doing their billing, they would either need to page for the pharmacist that did the service to come and sign it electronically, or give that technician or bookkeeper access to their information to be able to sign for them, depending on their ability to do so. Any questions? All right, well, I think I'll give it back to Michelle to wrap up then, and thank you so much.
Thanks, Olivia. That was terrific. I think that'll provide a great resource to pharmacies. We've contemplated adding on an immunization billing section to that, as we've had a few questions about that as well. So in the future, maybe we can adapt that if there's any interest. But with that, I was wondering if there was any questions for myself.
Hey, this is Andy. Can you hear me?
I can hear you.
Okay. Well, Michelle and Olivia, that was a really awesome presentation. I've seen a few versions, where a pharmacy that quite isn't doing WPQC, MTMs, and Medicaid yet, but kind of have all the resources in place to get going. So as far as presentations, that one is invaluable. Thank you. I guess my only question would be, is that the presentation going to be available later that I could share with some of my staff?
Definitely. That's why we've recorded it this morning. It was kind of I looked at the slide content for our agenda today and thought, I want to give something else to participating pharmacies, and Olivia generously offered to record the presentation. So as soon as Carrie has it all downloaded and whatnot, she will be sharing it with all of the participating pharmacies for use with their staff. So
awesome. Yeah, I will definitely.
And I'm going to probably hand it back to PSW as well. So
very thorough. Thank you for your time.
Yeah, no problem. Any other questions out there? So we'll make it available. I noticed that I put my phone number and Olivia's email address. So with that, you can reach me at first initial M Farrell at Boscobel Pharmacy as well. I'm sorry I didn't update that slide with my information. Additionally, like I've said before, if you have questions about the WPQC program, resources, etc., Carrie Trapskin is the guru on that and can certainly get you in touch with someone that can help you she's authorized the sharing of her email as well. So that is out there for your use. And with that, I encourage you to get out there, identify some patients, and, let's get a little stronger as community pharmacy every single day. Have a great holiday, and thanks for your time this morning.
Thank you, Michelle. Everyone have a great day.
Thanks, Carrie.